Fewer children under the age of 5 are dying today, according to the latest data from UNICEF. Globally, the number of young children who died in 2007 dropped to 9.2 million, compared to 12.7 million deaths in 1990. Dr. Peter Salama, Chief of Health at UNICEF, attributes the decline in the rate of child mortality to the better maternal healthcare systems and disease prevention control programs.
Botswana is providing a very important example of a country with a very high HIV prevalence that has now turned the corner and where under 5 mortality is starting to go down. And we think that's really because there's been enormous progress in the coverage of antiretroviral treatment for adults, increasingly for children, and the coverage of prevention of maternal-to-child transmission has also been extremely high, well over 95% now in Botswana.
Countries like Laos, Bangladesh, Nepal and Bolivia made the best progress in reducing child mortality. Their under 5 mortality rates dropped by more than 50% since 1990. They are well on track to achieving the United Nations Millennium Development Goal of reducing child mortality by 2/3 by the year 2015. In Africa, significant progress is being made as well. Eritrea's under 5 mortality rate declined by 52% over the last 17 years. During the same time frame, child mortality rates have declined by 40% in Malawi, Mozambique, Niger and Ethiopia. However, despite this progress, the highest rate of child mortality remains to be found in Africa. Sub-Saharan Africa accounts for almost half of all global deaths of children under 5. At the same time, the region accounts for only 22% of all births of children. Sierra Leone is the country with the worst under 5 mortality rate in the world. 262 out of every 1,000 children die before their 5th birthday. The main causes of child mortality are pneumonia, malaria, diarrhea, HIV/AIDS, and vaccine-preventable diseases such as measles. Undernutrition is also a contributing major cause of more than 1/3 of the 9.2 million under 5 deaths worldwide. To ensure these children have the opportunity to survive, efforts to address the nutritional needs of women, infants and children must be accelerated. There is more work to be done.
One of the challenging things is, as we're more successful, in some ways that the task becomes a little harder. And the reason is, as coverage of these sort of basic services gets higher, we start to need to reach the most underserved populations who are sometimes the most difficult to access.
A greater focus also needs to be placed on newborn and maternal health and the basic strengthening of health systems in affected areas. This is Roshni Karwal for UNICEF Television. Unite for Children.